It's Dr. Steve Shelton. I've been with Prisma for 27 years. I'm primarily an emergency physician, but with COVID, I have been the COVID-19 incident commander for the Midlands. This is exciting and quite an honor. I consider this the start to the finish as we move into this process of trying to get enough immunity in the community that we can bypass this COVID, get past it, and no longer be a major issue for us. I know there's a lot of anxiety associated with this, but I'm confident in the FDA and making sure they have approved an effective vaccine. And I feel like I'm honored to be here to receive this and doing my part to make sure that we're combating this disease. Once receiving this shot, I recognize that I'm not immune just because I received the vaccination today. And it's very important that I maintain those preventive measures of wearing my mask, maintaining my social distancing, and washing my hands frequently.
My name is Jessica Hobbs, and I am an emergency medicine physician here at Prisma Health. So in the emergency department, we see COVID patients every single day. We are seeing those numbers going up, and we're seeing an increased number of sicker patients almost every single day. I would say every shift that I work, I have to have at least one difficult conversation with a family about a patient who has COVID. I am very excited that I got to get the vaccine today. The impact on our fight against COVID here at Prisma Health is really, I don't even know if I can describe how excited we are about the impact this will have. The fact is that we take care of very sick COVID patients in the emergency department every single day, and anything that we can do to help that fight is so exciting. We feel like, I think, every day we're seeing our numbers going up, we're seeing our patients being sicker, and this is really a bright ray of sunshine and hope for us that we're kind of coming over the hill and maybe seeing some of the light at the end of the tunnel. Even though we're starting this vaccine process today, which is very exciting, the effects of that vaccine aren't going to be seen for quite some time. That has to do with the fact that it's going to take a while before enough people get the vaccine where we really start to see that impact. And in the meantime, it's really important that people remember that hand washing, social distancing, and masking are critical and remain critical as part of our response.
My name is Alejandro Ponce. Well, I'm working for EBS department, and then I'm working for those ICU and WICU, and that's to keeping clean, well, the hallways and all in both departments, and the rooms, the COVID-19 rooms. That's why it's very important for me to get the vaccine. I feel better than 15 minutes ago because now I have the vaccine. That's what I want to say. Thank you, Prisma Health.
I'm Raymond Bino, and I'm a trauma surgeon that works with the Department of Surgery. I believe in science, and it's important that we support this. Seeing us here today is important. You know, they recognize the fact that, I'm here and I'm taking the vaccine because I'm taking care of people who potentially could transmit it to us. And that's an important fact. Just be very active about this and proactive. And, you know, when you look at grandma, grandpa, you know, moms, dads, you really need to make sure that you understand that this is not something to be playing with. The death toll is significant, and we need to be very supportive of this process.
My name is Connie Chandler. I work at right now I'm working at the COVID drive-thru. This is the best thing that we can do other than the mask, but there's no other options really. This is what we have to do. I lost my father-in-law, I lost a teammate, and for me, it's to be safe. I work at the COVID drive-thru, and if this works, I have 5 children, 2 grandchildren, and I want to be around for my kids and my grandchildren, and I want to feel safe. I don't want to feel that they're going to give me something or I'm going to give them something. Tomorrow could be too late. That's the way I took it. I was going to wait and see how everybody else did. I was one of the ones that, yes, I was going to wait to see. And I kept thinking. I said, I work at the COVID, we work at hospitals, ERs. I mean, tomorrow could be too late while I'm waiting to see how someone else is going to do. That's another month, 3 weeks. I could catch it and I don't know where I might end up. So I said, no, I'm going to go ahead and get it. So if I can be safe and this is the way to do it, then this is the way I want to do it.
Still got strides around.
The first gift for Christmas.
Is that the bottle?
All right, you ready? Yeah. 1, 2, 3. Moving on. Separate containers. So each one of these is the pizza boxes.
Thank you. And flip it around so we can see the bottles. There you go, that's perfect.
I can log off mine because I can log off.
Yeah, we got it.
Much, but we can squirt out.
You have to go in and out 6 times.
So that was wonderful. It did not hurt at all.
Get vaccinated, he was out there telling us, came in on his day off. Get vaccinated.
Perfect. No blood. Strong work, Ellen. Thank you. Good. Very cool of him. All right. There we go. Yay! First one. Hooray!
Thank you.
Thank you. Have to get some from this. I'll try this again and see if it's
Wow, perfect execution.
Thank you. No.
I think that you're lauding your own efforts. It's very good.
Well, I'm used to narrating in the ER, so
I think that's helpful for patients, probably.
there we go.
Hooray!
Yay!